thank you for inviting me. I'm really grateful to the organizer to invite me to share with you the challenges we have faced in developing an evidence-based strategy at a national level. At this moment, there is a health bill in France, and one of the articles of this bill is the creation of a new institution from those three logos, and that is not important, but it's important for me because I'm included in one of them. But the other thing very important in this health bill is that the first pillar is about prevention. And last week, on the 1st of December, there was a discussion at the National Assembly between a member and the Ministry of Health, and they said the importance of drug and addiction prevention in that future health bill. So what is the problem? The problem is that social demand for addiction and drug prevention is very high, and so unevaluated, naive projects are created every day in the field and everywhere, and often without state money or even with state money. And health authorities are not ready to deal with that demand. And what is done for the healthcare system, where there is guidance, is not done for the prevention field, and there is a void that is filled by a lot of initiatives. So here is what we have been trying to do during the last 15 years. So first of all, we had some research in France, and you will see it's not a success story. And then we did try to develop research in France. And then we also tried to develop Strengthen Families program, and it was Wally talked about it, and also David. And that was not a success story. And then we tried a second attempt, and we also said we should do scientific literature review in French, so we did it. And then we tried to do a call of application for field project, and I will explain it later, and then finish with the current situation, and I will try to give you some take-home messages. So the first research was done at the regional level of Île-de-France. There were 10 schools, 600 pupils in the intervention group and 600 pupils in the control group. And it was a three years project with, as you see, three measures of effect. And the result was really disappointing. As you can see, this is the proportion of pupils who consumed alcohol 3 times or more during the last 30 days. As you can see in the girls, in the action group, the consumption has doubled in the action group. And for the cannabis, I didn't show the result, but it was for the boy, and you have an increase in the action groups. You had 44% of pupils who had used cannabis compared to 34%. So that research was a failure, and I was invited to comment those results in a conference in 2004, and I said that this program should not be used anymore. And to my surprise, all the people who did the program was very disappointed, because even if the result was not good, they had a lot of enthusiasm about that program. So I had to present the literature, and I presented David Foxcroft's Cochrane review, and also the report from the review from Thomas Baber, Alcohol is not an ordinary commodity. So we had to have more research in France, and we did in 2005 and 2010, we did a call for proposals, and we received no addiction prevention research projects in 2005, and no addiction research projects in 2007. And maybe it was one of the effects of the failure of that first research in France, pre-PAC, but we were very disappointed. And one of my friends said, maybe it's no use to water the soil if there is no seeds inside, meaning that it's not used to put money if there is no research team ready to go for it. So then we tried to do it ourselves, and we decided to test Strengthening Families program in France with an RCTs, and it was written in our working program. And unfortunately, it went public because the health minister, Roselyne Bachelot, announced it in a conference, and this had a really bad effect. We had to stop the recruitment. We intended to recruit 150 families, and we stopped at 20 because conditions were not good. Main reason of the failure was that we went too quickly. We had to meet the political calendar announced by the minister. That was a problem. And also, we didn't realize that the enthusiasm of the leaders at the municipality had not reached the lay social workers, and that's an understatement. And we also, the public debate had created negative comments in the press that it hurt the process, and I have two examples. In the Parisien in 2010, it was a title said, "Researchers trying to help families in trouble." That was not right, because it was the universal program, it was the seventh session, and we did no focusing on troubled families. And also another statement, American program based on cognitive and behavioral approaches. As in France, this is for a Freudian cultural country is nearly an offense. And you could see also that some experts said, I do not see what impact it could have on families here. So you see, we had help from the press and the medias. And another journal called Tout Éduque, is more a professional journal, said, first time in France, an American parenting program evaluated by CNRS. CNRS was the institution, research institution we had commissioned. So that first attempt was not a success. We did a second attempt, and we went more slowly. We started by we didn't do an RCT at once. We tried with a pilot study, and very slowly. And we did during between 2012 and 2015. We tried with one set of family, and then in one town, then in a few towns. And now we know that it is possible to do that program in France, and now we want to do an evaluation, and we have now 22 communities who are willing to participate to the programs in all the parts of France. So another reproach that was done to us is all the literature is in English. We don't read English, and we don't read scientific papers. So we did our own literature review in French, one on drug use, one on alcohol use, and one on tobacco use. And to be more simple, we did also easy to read version of 4 pages version, and we sent them all to the local authorities. And here are the comments, the comment from the local health authorities. What do you want us to do with this? It's useless for us. We just need a half a sheet of paper with some bullet points to help us to select the right projects to subsidize. So this is depressing, but we have to listen to that because this represents the needs of those local authorities. So another thing is, as I said at the beginning, there is a lot of projects going on the field that we don't know really what happens. So we are trying with Mildeka since last year. We did a call for application for field project, and it was launched in mid-2014. And you must realize that no money is offered. No money is offered. It's only an evaluation opportunity, and we were surprised to receive 80 projects. That means that there are a lot of teams who run projects and would like to be evaluated. A jury selected 5 of those projects, the best ones, and we asked them to try to draw a logic model, and you see that on the next slide. And we have hired 2 evaluators, and they just have finished the field visit to those teams. And I just have to mention that one of the projects that have been selected is Unplugged, a European project, and those local teams had found their way on their own to find the Unplugged project, and without the assistance or guidance of the national level. So what did we ask in that for the applicants? They had to explain the origin of the program. They had to tell us the hypothesis behind the program, the mechanism, the theories. So we are asking scientific questions to lay, field workers, and that was not very easy for them. We also asked them to describe the inputs, the resources they put on the program, and also the activities, describe the more precisely possibly the activity and the respective contribution to the final output. This was quite difficult for people who don't have a scientific culture, and also to tell us what they thought could be the short-term, mid-term, and long-term effect. So what is the current situation in France? So we, at the national level, we are taking the initiative to evaluate the adaptation of 2 foreign programs. One of them is Strengthening Families Program, and the other one is Nurse-Family Partnership. Dr. Kellam talked about this this morning from David Oles. The French name is Panjo. And we had the good surprise that a local team from the south of France did a need assessment on his community and did ask for good behavior gain. So we are subsidizing them, and Megan Samble came to do a training in September, and for the moment it's a pilot study, but we want to see it grow. And as I told you, we are beginning to evaluate 5 local initiatives. One of them is the European program Unplugged, and we will ask the help of Fabrizio Fagiano, who was the lead researcher of that program in Europe. And for the first time, as I told you, we had no success in offering money for project research projects in 2005 and 2007, but in 2015 we had more success, and we have at least 5 projects on the field of addiction prevention, and we are just starting to examine them. So the take-home message would be we have to use a mix of top-down and bottom-up approaches. We have to reorient the money given to naive prevention program to evidence-based program, but this must be slowly done. Of course, the call for proposals for research projects are useless if there are no research team ready to submit, so we have to find other ways to do it. When possible, do your research under the political radar, if possible. And do not skip, as we did, the adaptation process of a foreign evidence-based program. And we have to get the help of a local leader. And the 2 places where we have success are linked to a local leader who is deeply rooted in a community and who is able to not do the mistake we would do from a long way from there. And we also have to be patient, and the development counts in decades and not in years. Thank you for your attention.